Hi, Diane. All right, well, it is 6 o'clock. So I just want to say those of you that are on this evening, thanks for joining our virtual town hall meeting. Thanks for zooming in. This was an opportunity for the district to give an update on the status of COVID in schools, particularly what we're seeing in Clyde-Savannah, the impact that it is having on our students, staff, and community at large. An opportunity to have Diane Devlin from the Wayne County Department of Health, or Department of Health Director, join us this evening to be able to answer any questions and also to give a synopsis of what she is seeing from the county view, trends, and how she is working with school districts to ensure the most safe environment for our schools, Clyde-Savannah and all 10 other school districts in Wayne County. And also want to introduce Mara Pierce, who is our COVID coordinator. She'll be officially appointed by the board next week. And this is a position that we're able to fund by reimbursement through the county for COVID funds. We really appreciate being able to fund that position to help us along getting through this difficult year. So I'm just going to start with, this has been certainly a challenging year for school districts. We are not immune in Clyde-Savannah to the challenges that COVID continues to present. We ended last year with the hopes and dreams of being able to return to a somewhat normal school year. And I think we were probably off to a good start with that. And we knew that there was a strong possibility that the biggest difference, number one, we'd be back in person. That was our goal, 100% in person, 5 days a week. And we have realized that goal, which has been awesome. And what we probably knew that we'd be wearing masks, and at some point that could have been a masking mandate. And that really did happen. So I want to say that I truly believe that our masking in schools has really mitigated widespread COVID positive. Time after time again, those that have been wearing a mask when we go through our quarantining protocol and contact tracing, those students really, either A, did not have to be quarantined or did not get sick due to, or less of a chance of getting sick drastically because of wearing a mask. And Diane, she'll reinforce that a little bit when we talk about what she's seeing, and particularly around the mask wearing. So with that said, I do want to recognize that this has been a challenging time for our community. One of the biggest challenges that I continue to work with parents is the time out of the classroom that students are receiving because of a few things. One, they either have been quarantined by the Department of Health prior to coming to school or being allowed to come to school due to exposure. We've had a number of students who have come to our nurse's office with symptoms and we've had to send home and subsequently tested positive. We've had a number of staff members test positive this year, but it's becoming more challenging for our families to have their children be staying at home for some of them multiple times. It is creating a burden on their schedules, obviously, daycare, and even employment. It's difficult to have to continue to take work off. So the district has been working with the Department of Health, and the Department of Health has been working tremendously in trying to help those situations with some satellite testing offices that the county is working on. So Diane, we'll have you speak to that in a little bit as well. And we are so fortunate that and thankful that you are working to put that together. I thought that was a brilliant idea on your part, and you making that come to fruition is absolutely incredible. So thank you so much, Diane, for that. So with that said, why don't we start with our local numbers here. I'm going to have Mara Pierce just give a report on to date from the beginning of the school year, what our COVID positive numbers are between students and staff, a breakdown of each of the buildings, and then number of quarantines that we've had in Clyde-Savannah since the beginning of the school year. And then we'll turn it over to Diane to talk about the trends in the county, and then how we can continue to keep kids safe and some other, we'll open it up for questions as well. So Mara, the floor is yours.
Okay, so since the beginning of the year, we have had 23 students, 23 positive cases for students, 5 positive cases for staff. The quarantines that are Department of Health ordered were 112. This number does include the positive cases. And for school ordered or sending out pending a test to come back, we've had 88 students. Some of these numbers are doubled as students have been sent out more than one time. So they're not perfect, but those are the numbers.
Okay, thanks. So, just hearing that compared to last year, I think I could count on my hands how many positive students we had. Obviously, we had a number of measures in place to mitigate that. This year, 21 doesn't sound like a lot, but 21 cases is a considerable amount. And then the number of quarantines that we have is a considerable amount. And again, that means kids out of the classroom and loss of instructional time. That is a challenge. But let's hear from Diane. You're working with our district and you're working with 10 other districts on top of working with all the other municipalities, nursing homes, the law enforcement facilities. So this is not an easy task for you or your team. But what are you seeing as far as, if you could share with our attendees this evening from a county perspective?
Yeah, thank you for inviting me to participate tonight. I just want to say thank you to Maura and both to Superintendent Hayden for being such partners and helping us combat the issues at hand in regards to COVID. It's been a long haul since March of last year. It's been a great working relationship with them as with all other school districts. Today, when I pulled the reports that we received from the state in regards to school positive cases in our school districts currently right now. So when we have a positive case, they're considered current and active when they're in their 10-day isolation period. So currently right now, throughout all 11 school districts, we have 103 positive cases in schools. So Clyde-Savannah is doing really well. They have one of the lower numbers. We have some larger districts that have had some substantial numbers. And we're working with each school district as we need to reach out to them and to have discussions and to see if there's any other mitigation measures such as screenings and like we did last year, or social distancing or anything like that we could do extra to help alleviate any problems. But currently, as of this morning, we have total since the beginning of time of COVID in Wayne County, we have 7,210 cases. We have had 6,754 resolved. Just in the month of September alone, we had over 1,000 new cases. And we are seeing a trend of more and more students becoming ill, children becoming ill with COVID than we did with any other variant. So Delta variant is much more contagious than the other variants. For example, the UK variant, which they also reference them as the Alpha variant, that an individual infected with that variant would infect up to 2 other individuals. With the Delta, they can infect up to 5 or 6 more individuals from one case. So it's very infectious. It can cause much more severe illness, hospitalizations, and death. We are seeing a trend of all of our case numbers or daily counts. Like today, we had 56 new cases, 14 of them were children. Yesterday, we had 47 new cases and 24 of them were children. So we range anywhere from mid-20s all the way up to almost 50% on a given day of our cases being kiddos. We did not have that last year. Last year, we had very few kiddos. As Superintendent Hayden mentioned, they didn't have as many positive cases last year. We had more adults getting ill. And right now, those that are in the hospital, as of this morning, we had 15 individuals in the hospital. They're all mostly, well, I think they're all unvaccinated individuals. If we do have anybody who is vaccinated that needs to be hospitalized, it's very much a short stay. We have had a couple children, a couple infants in the hospital, and recently a school-age child in the hospital, and that child was on a ventilator, not a Clyde-Savannah School District individual, but any child in the hospital is one too many, as in with any other adult too. Currently, right now, the caseload that we are following, we have 395 individuals that we are currently actively monitoring that are on their 10-day isolation period. So back in our heights, back in January, end of the holiday season, we were at 650. So we are definitely on an upward trend. We are hearing reports across the country that the actual cases are on a downward trend. We are not seeing that here in Wayne County yet. And even in the Finger Lakes region, we are not seeing that. So when Superintendent Hayden was talking about the testing, we are aware that the pediatricians' offices are very much inundated with families calling, meeting appointments for children who have been taken out of school because they're symptomatic, because the state guidance currently says a child in a high transmission rate area, which Wayne County is, needs to have a PCR in order to go back to school because they're showing symptoms of COVID. Now, mind you, those symptoms could be similar to other things such as allergies or our normal back to school colds that we get in September and October. But unfortunately, we are seeing even kids that normally have allergies, they are testing positive for COVID. So we're trying to be very careful with that. And the pediatricians want the kids to be tested with PCRs, but unfortunately, the demand is so much higher than last year that they weren't really prepared for that because, last year they were able to manage it. So currently right now, I've been working with Rochester General Hospital, Rochester Regional Health System to set up some PCR testing that the, pediatric offices can refer those children who are symptomatic, been sent home from school, but have not been exposed to a positive case. So those children could be referred to a off-site PCR testing that's going to be set up by Rochester Regional Health Systems. It looks like we might have a site in Sodus and a site in Newark where parents can take these individuals to get tested. And it does not matter if your child is not part of the Rochester Regional Health System practices. If you are in a Wayne County school and you need to get tested and your pediatrician is unable to do that, you can still take your child there. So there will be more information coming on that. We're hoping that will be up and going soon. And just on a side note, we are hearing from the state that they are starting to look at whether or not these type of children who are low risk, not been exposed to somebody, but are exhibiting signs and symptoms of COVID to have a negative rapid test to go back. However, that has not been approved yet. And that is not something that I have approved for our county to be doing until the state decides to do that. So hopefully there'll be some more relief for the families to get their kids tested quicker, get them back into school quicker, and also help relieve the pediatricians' offices with the immense amount of phone calls they're getting and requests for visits. So,
Diane, that is really huge. It's really refreshing to hear that. That has been the biggest frustration that I think we're experiencing. Prior to COVID, a student would come down to the nurse's office with a stomach ache, or this time of year, we have a lot of seasonal allergies, which could lead to sinusitis or, sinus infection or whatever, a number of things, postnasal drip, right? And postnasal drip, as we know, can make an upset stomach. So prior to COVID, you come to the nurse's office, it seems like you have allergies, or it seems like, maybe you're nervous for a test, or you're anxious, and kids get tummy aches for a number of things, right? But I think what's frustrating is, as you know, stomach aches have been one of the primary symptoms of COVID in pediatrics. So we as a district, I know other districts as well, have been very extra cautious in responding to students with stomach aches, which could be due to a number of things. They get their stomach ache, we are going to send them home. The sniffles or cold-like symptoms, we send them home. We do have the Binex Now tests. We have been administering tests to those students. The parents have consented to that. We test a student. It seems like 9 times out of 10, those tests are negative, right? So, but we still have to send the student home. What I'm hearing is that could change, that if it's a negative test and you have COVID-like symptoms, that they may be able to stay. I think that's really refreshing to hear. But right now, we're still following the rules. If you have a COVID symptom, we'll do a rapid test with consent. We'll send you home. Now, if those symptoms subside, right? They're fever-free for 24 hours. The symptoms, if there's no fever, but we're waiting 24 hours, can students come back? And if there's multiple symptoms or symptoms can continue to develop, they're not allowed to come back, and they have to get the PCR test or an alternate diagnosis from the physician. And I feel like that's been one of the difficult things that parents that are experiencing, is that not a lot of the physicians are giving, a diagnosis per se. What we're seeing is COVID not probable. Patient suffers from seasonal allergies, or patient suffers from anxiety, or those types of things that could lead to some of these COVID-like symptoms. And then we have to, call the parents back and say, unfortunately, this is not an acceptable diagnosis from the doctor. That causes additional frustration. And then, like you said, to get into the doctor, they are so overwhelmed. It might take 2, 3, 4 days just to get into the doctor, for them sometimes to say, not even have a diagnosis, and then have to go back. And these kids are already out 5, 6, 7 days. So, that has been really challenging. So I'm hoping to see some relief on that. I think with anything, and we always talk about, the data is so important to analyze the data. Are we seeing the trends? How many students that we test here that are negative, that are sent home, that end up testing positive? So we'll look at that. And I think the state is looking at that information as well. Is there enough data to support these, the probability of, COVID? So, but again, we don't make those decisions. The New York State will make that decision, where we are the enforcers, right? And not always, that's not always a popular position to be in. I know that as a superintendent, that as a director of our health department, and it's part of the job. We get it, but our overall ultimate goal is to keep everyone safe. So, again, I appreciate and thanks for keeping us in the loop and advocating for that testing site for the PCR test for students in our region. That is huge. Those were the big things, particularly the symptoms. And I would say that our parents here in Clyde-Savannah, for the most part, do a really good job with not sending their kids to school when they have COVID-like symptoms, whether it be a stomach ache or a headache or a fever, those types of things. I can say that, those students have stayed home, and then we've received reports that some of those students have tested positive. So if they were sent to school, then they test positive, then we're dealing with contact tracing and the potential of spread. And our biggest thing is to minimize spread, right? So the contact tracing part of things, your team, I don't know how many you have on the team now. I know you added another school specialist to the mix.
Starting soon, not yet started. So yeah.
So they are tremendous. And there's a lot of behind the scenes things that occur that I don't think folks truly realize what goes in to the contact tracing protocol, the number of conversations, phone calls that go back and forth to your specialist at the Department of Health, yourself sometimes, a lot of the times, and emails, and then reviewing of all of the criteria. So I've asked Mrs. Pierce to kind of walk through what our typical contact tracing protocol would be if we were to hear that someone tested positive, whether it be at home or we tested someone here and it was positive, and then we start that contact tracing protocol right away. So Mara, this is a big deal. We're so happy to have you in as our COVID specialist to be able to facilitate this with all of our buildings. This is work that is done into late hours in most evenings, on the weekends, holidays. There really is no break on top of the work that you do as our middle school principal secretary. So why don't you just lead us through what a typical contact tracing event would entail?
Okay. So again, yes, you're not wrong. I spend a lot of time on this, and the people at Wayne County, the school mitigators, have been amazing. They've helped me so much. So when I start this, I'm informed of the positive, whether it's from the parent, from the health department, from the nurse, whoever may tell me about it. I then work with the building principal to find out where this student is, the classes. I pull the schedule, what class they're in, if they're in the elementary school. We look to see if they ride the bus to and from school. Maybe it's just one or the other. We figure that out. Then the transportation department starts watching video to find out, make sure the kids have their masks on. They have seating charts, we get those. We then look at lunch tables. Where do the kids sit? For the most part, they all have assigned seats. We have our high school, middle school building broken up into 3 different lunch spaces, which is taking a lot of chances of them being quarantined because of lunch out of the picture. We then look at the classrooms, and then we go to sports. I compile the list, send it to the county. They give me the okay based on the criteria that we used, and then that's when I can start making the phone calls. So in a lot of cases, like Mr. Hayden said, when the kids have their masks on and they're wearing them appropriately, they don't need to be quarantined, especially if they're in a classroom. So I do have a fancy little decision tree for identifying contacts that I'm given that I work from. And there's a couple different, there's an indoor classroom setting and a not a classroom setting. So for example, if they're inside in the gym for a volleyball game, it's a little different than if they're inside in a social studies class. So when they're at their desks, and all the teachers have provided me seating charts so I can look at those. If they are 3 feet or more from another student properly wearing their masks, in most cases, they are not going to be quarantined. So again, the masks are huge. If they're less than 3 feet for more than 15 minutes, and their masks might be, half down, their noses are showing, the chances of them being quarantined is a lot higher. Now, kids, they're up, they're down, they're everywhere. But for the most part, they bebop around. So they're not really sitting next to somebody in their face for 15 minutes straight. So we can work that way. In a non-classroom setting, we're going with the 6 feet rule. So it's going to be less than 6 feet from an infected person for a cumulative total of 15 minutes or more over a 24-hour period. So if you have a positive person around you for cumulative time at 15 minutes or more in 24 hours. So if that person came to school 2 days in a row, that they're now being looked at as a quarantine time, your chances are a little bit higher of being quarantined because of the time spent with them, especially if you ate at their lunch table, especially if you had breakfast with them, something to that nature. So, and that's where I'm at. And that's when you hear my voice and I call you and I say, sorry, I'm making this call, because usually that's what it sounds like and everybody knows what I'm calling. So that's about it. Oh.
It is quite the process, as you can see, and that's just really an overview. But can you imagine the amount of time that takes to do that and to do it accurately? We have sign-ins in each of our classrooms. If someone is coming into the building or they're not typically in an area that they would be, they're signing in. So we can really quickly go and find out who is in this space, who is in this room, and do that contact tracing as quick as we can. And I feel like we have a really, really solid system in place here to be able to do that. And honestly, I think that's contributing to our lower numbers in Clyde-Savannah, is that we are quickly able to identify, isolate if need be, and then quarantine as needed. So Mrs. Pierce, she mentioned the cafeteria. That was not the most popular decision that we had to make, I know, for the principals and myself, and I continue to field some questions. Why are we, we have this brand new cafeteria from the capital project, and why aren't all of our kids in there? And honestly, like we said, it really is a capacity issue. We are trying to spread out our kids as much as we can during lunchtime when they are, having their masks off. So we're lucky to be able to utilize a larger space with our library and our auditorium. I did get a suggestion today, and I will just say this, that I will pass this suggestion along if it's not already being considered, and it might already be being considered, but not sure when it will be implemented, but rotating the students to each of the spaces. So we may have a number of kids that, that might be in a library, but have not had an opportunity to eat in the cafeteria. And we want them to experience that awesome space as well. So we're going to look at that suggestion. I think it was a great suggestion, and just being able to have the kids rotate would be really cool. I have a few questions that are coming up that I want to answer, and the one question here that, and I really appreciate this question being brought up. I was going to bring it up if it wasn't. The question is, will we see the virtual option return soon for those stuck at home on quarantine or waiting for a negative test, right? So as Diane Devlin mentioned, you know, one of the biggest frustrations is we have to wait for that to get in to get a test, to wait for the test, and that could be 2, 3, 4 days. So, you know, as far as full virtual as we had it last year, we're not going to see it like that for isolated cases or individual students or groups of students. But we as a leadership team are discussing and have discussed what does instruction look, how can we continue to support students who are out on quarantine utilizing our Zoom technology. So the last discussion that was had at the Principals Advisory Committee this past Monday was discussion around, can we support kids, can they Zoom, at least Zoom into the lesson to view the lesson. There may not be as much engagement with the teacher if it's just one person Zooming in. But I think that it would be great for kids just to be able to be present to watch, you know, to watch the lesson. Teacher will follow up then with any additional materials and what have you. So that was a really good question, and it's something that, you know, we are discussing, and hopefully that is going to be communicated out to students and families soon. So thank you for bringing that up. We do recognize that we need to be able to support kids and utilize our technology to do so. There was another question for the health department. So if we find out we're exposed, but the positive person omitted neglected to share that there was a contact to the contact tracing, what can be done or what can we do? So I'm sure, Diane, that, you know, you probably have gotten phone calls saying, hey, I know a lot of people got a phone call from the Department of Health or the contact tracers saying that they've been exposed. I know for in fact myself, I was around this person, but I never got a call. And, you know, it might not be maliciously neglected to say that this person wasn't there. Hopefully that's not the case. That may happen, unfortunately, but let's just say that they were missed in the, you know, what can someone do then?
Right. So when we learn of those situations, it could be both ways. It could be where I was exposed but not called, or I was told I was exposed but I was not, meaning they refute the actual exposure days. So we look at those thoroughly. We have a discussion. We'll actually even reach back out to the case, you know, index case to say, okay, were you exposed around this person? We'll have conversations with the school if it is at the school level. If it's out in the community, again, we'll have more of a thorough conversation with the actual index case and go from there. But we will quarantine individuals that feel like they've been exposed and give them education on what they need to do. We could add them to a case at any time. And in those cases where we find out that somebody doesn't need to be quarantined because they, you know, the amount of time they might have been exposed to the individual was less than what we first initially thought, or any given circumstance, we can make not accommodations. We can make, you know, make changes to the actual quarantines if they fit the protocol of that. And just to remind everybody, if you're vaccinated fully, and you're exposed to an individual and you're asymptomatic, and this goes for your children that are 12 and older, they do not need to quarantine. The only time they would have to quarantine is if they become symptomatic. So, because even though you've been vaccinated, you may still get the virus, but the virus is not meant to prevent you from getting the virus. The vaccination is not meant for you to prevent you from getting the virus. It's been a long day, sorry. But it does prevent severe illness, hospitalization, and death. We see very, very, very few positive cases of individuals that are severely ill that have been vaccinated fully. So get your kids vaccinated, and that will keep them out of quarantine as long as they remain asymptomatic. But yeah, we can quarantine somebody or decrease their time of quarantine if it's warranted based on what information we learned. So yeah, it's a fluid process for everybody.
That's a good point. You know, I think there was early on with the vaccine initiative, there was this maybe a false sense of full protection, right? So maybe we let down our guard a little bit on some of the other measures, mitigation measures, including mask wearing, good hygiene, distancing, you know, all of those things. So I think, you know, we've seen, yeah, you can still get it. You know, luckily what we're seeing is it may not be as serious or result in hospitalization, but the reality is that it, like you said, it was never meant to be 100% effective and you get it. It definitely helps your chances of having a less duration or serious bout with it. So a question that's come up a few times as a superintendent from phone calls that I've gotten from parents saying, you know, we were at a sporting event. We know that so-and-so student was quarantined, or so-and-so adult was quarantined or is on quarantine. And they are present at an event. What, you know, what is there a law that if you're quarantined that you are, this is an order from the Department of Health, could there be consequences for someone who is not following an ordered quarantine?
There's consequences for isolated individuals, those who are infectious, being out and about. But I have to say, there's just so many contacts to everybody that there's just not enough time to follow up with them, hunt them down, and have discussions with them. But we will if we are notified of that, especially if we find out that contact that's quarantined is, you know, symptomatic and stuff. So they do get phone calls or text messages from the state. So when they are out and about doing whatever they want to do while they're supposed to be isolated and quarantined, they could be fined by the health department. Have we done it? No. Can we? Yes. And it all depends on the situation. I mean, if we have a super spreader that is not willing to stay home and they're spreading the virus all over the place, that is an avenue I can take. So yeah.
Yeah, it's tough. You know, everyone wants to participate in these things, whether, you know, support teams, support events. And, but again, you know, we're really trying to minimize any potential widespread outbreak on this. So I appreciate that. And we do have lists, you know, we know who's on the not permitted list. Do sometimes individuals slip through the cracks on that if it's a, you know, football game outdoors and someone gets in somehow. But if someone there is at an event and they know of someone, they can certainly anonymously, if they wanted to just share that in the moment, then we can address it, obviously. So that was something that comes up often. Another question that is on here tonight, and this question has come up from time and time again, is the proper wearing of the masking, right? So is it necessary to have the nose covered? We are finding that on any given day, we have to multiple reminders to students that their mask drops down below their nose. Now, I honestly they're just going to fall down naturally, and most of the kids are putting that. We do remind them, Johnny, bring up your, you know, over the nose or whatever. So we do that all day long, but the reality is to have 100% of these masks over the nose properly every single day. It's our goal. You know, with reminders, kids are being compliant to that. But just to answer that question, as far as the proper mask wearing, have it over your nose. Is that still the appropriate way?
Yes. You have to remember the virus is airborne. So you have larger droplets will fall to the ground if somebody's coughing or, you know, breathing out and has the virus breathing out. But the small aerosolized droplets that linger in the air for several, you know, up to a couple hours. So if you don't have the mask over top of your nose, you can breathe that in just by normal breathing. That's why we want the mask covering your nose, covering your mouth, because that's your best protection. And it'll keep you from getting quarantined by the health department. So it's the best protection. That's the number one protection that we have seen all along, other than getting vaccinated so you don't get a really severe illness. But, you know, good hand hygiene and wearing the mask is your best protection. So cover the mouth, cover the nose.
Absolutely. And another, when you talk about good hygiene and hand washing, and, you know, early on when we we're just learning more about, how maybe even before we truly know how the disease COVID was spreading. Surface area contamination and spread was something that we really thought was contributing a lot. So we're finding with the research that that really wasn't the case as much, and it was the air, the droplets and what have you. But not that, if someone has COVID and they're sneezing right on a desk or something, right, and you're having those droplets there and you're wiping your hand on that particular desk at that time, and then immediately putting your hand in your eyes and rubbing your eyes and over your mouth, or picking your nose or something, then the chances that, you might come down with an infection are greater than just someone sneezing 5 hours later. You may not have that surface area contamination on there. So, but good hygiene, I think we saw a tremendous decrease last year in other ailments like bronchitis and laryngitis and all those bugs that you typically get. We weren't seeing a lot, but I think, the flu for sure, because we were so, really paying attention and reinforcing the good hygiene. So I think if anything, those habits are continuing. We have our hand sanitizer stations. Kids are washing their hands. Our kids are asking to go to the bathroom to wash their hands before lunch. That was never happening. I mean, come on, it's really.
So just to interject a little bit, Superintendent, in the last year in our flu season, from fall to spring, we only had 6 cases of flu. We would normally get well over 1,500, 2,000 reported to us. We only had 6 reported to us. So that just proves that the, hand hygiene, wearing the mask, and last year we were socially distancing too because things were shut down. It works. And so it'll be interesting to see what we get this year with the flu.
Yeah, for sure. So we've been on about 40 minutes now. I know we have a number of attendees. We had a number of questions answered. And again, the purpose of this town hall meeting was just to, just check in with folks. This is the status of our district. This is the status of the county. These are the supports that we have in place that, we have to follow the protocol, the protocols and rules, and the Department of Health and school districts work in tandem. It's not one or the other. So we're, like I said earlier on the meeting, that we are bound to follow the New York State regulations and the State Education Department regulations. And they're not always popular decisions, that we make, but at the end of the day, everyone wants their kids to be safe. And I would hate that, if we weren't to be extra cautious, and I'll say that we could be being extra cautious. And I will always do that, because the last thing that I would ever want, and I couldn't sleep at night knowing that we didn't put something in place and a student were to get sick, or a staff member, what have you, and having the worst case scenario. And I know that, like you mentioned, that we have a child in Wayne County who was very, very sick and was in ICU and on a ventilator, and it can happen, and we definitely don't want that. And I do want to just give a shout out. I know I have a few teachers on here, a few administrators, board member, is that I cannot thank our staff enough for their continued day in and day out supporting kids to come back from 18 months in a virtual or semi-virtual world, to welcoming kids back full day, all day long, understanding that they're going to have some transition and challenges coming back to full day, what their interactions with one another, their interactions with their teacher and teachers and staff members. But I think we have the absolute best district when it comes to staff doing everything they can for our students. And I know that this is happening everywhere too. And I know any other superintendent's going to say the same thing, but I think just in general, I'll speak on the region and educators in general around the world. We do this and we do this for kids, and the last thing we ever want is for our kids to be not safe or not healthy. So that's why day in and day out we do this, as hard as it gets. Sometimes we've laughed, we've cried, and everything in between. So I just want to say thank you to everyone here. And Diane, I want to thank you again. You've just really been tremendous. not an easy job. Your team is phenomenal. And again, like decisions that are made may not be popular, but we're bound to these things. So we really appreciate everything that you're doing. And I know that the families can always reach out to the Department of Health if they want some more follow-up questions. I am not a doctor. I am not a health expert. I feel like we've become an urgent care almost at school districts. Never in my wildest dreams, I've been saying this the last few weeks, did I ever think I'd be in full PPE, masks and the gowns and gloves and the same thing as Mara here, administering COVID-19 tests, as a superintendent or even as a secretary. So we are still in crazy times. This pandemic is not over by any means, and we have to keep that at the center, that we have a ways to go. But if we continue to do these things, our chances of getting out of this sooner is far greater. So with that, we're going to end the town hall. And again, we appreciate it for everyone attending this evening. And Diane, thank you for your time as always.
Thank you. Have a good evening.
Good night, everyone.